Now, this next session is a really important session on how we promote action on health inequalities across the Member States and the European Union from now through to 2020. I'm going to introduce the panel to you in a few minutes, so we've got a superb lineup for this session. But before we do, we're delighted that we've got as our keynote speech at the start of this afternoon, Adonis Georgiadis, the Greek Minister of Health, to speak to us. And Greece, of course, has just assumed the presidency of the European Union, and the presidency always has a key role in setting the forward agenda of the European Union and influencing the activities of the Member States. So we are so pleased that he has given up time for us today, almost at the start of the presidency, to set out some of those ambitions, to learn about the Greek hopes for the presidency and how actions on health inequalities can help the Greeks in that role to contribute to the wider economic and social objectives both of their presidency and in meeting the needs of Europe. So, Minister, it's over to you. Yeah.
First of all, I want to thank you for the invitation. It's a great honor for me being here. And of course, I would have fine time to be here because this is a very important issue which we have to discuss. So the theme of my presentation is looking forward to action across the social determinants of health. During the last century, the average level of health of the European population has increased substantially. Life expectancy has risen from 46 years for men and 50 years for women in the 1900s in the UK, to 77 for men and 81 for women. The life gains in the majority of EU countries over the last 50 years have been more than 11 years, with the southern European countries presenting the highest gains. However, this increase hides provoking injustice in terms of major health inequalities. Lower socioeconomic classes, the poor and the socially excluded, die younger and suffer from long-term disabilities and chronic diseases. The health gap among socioeconomic groups remained stable in the 80s and 90s in Western Europe, but increased in the 2000s. The recent economic crisis has further aggravated the health gap among regions, countries and socioeconomic groups. According to the European Commission, health inequalities refer to avoidable and unfair differences in health that are strongly influenced by the actions of governments, stakeholders and communities. In May 2009, the WHO adopted a resolution inviting the Member States to take actions to reduce health inequalities across Member States through action on the social determinants of health. The attainment of highest possible health improvements in quality of life of all citizens are the core objectives expressed by the European Commission, the OECD, and other international organizations. However, meeting people's aspirations for health and health equity requires a special kind of symbiosis between health policy, scientific research and health actions in order to achieve effective implementations of the reforms. We need a common strategy, a global European vision and a unified effort to improve quality of life for our citizens, ensuring at the same time greater equity, a more human and accessible healthcare system. The WHO Commission on the Social Determinants of Health called for closing the gap in a generation. We have today the knowledge, the scientific evidence, the resources and the capacity to achieve this objective. What is needed is the political will to make this happen. The communications on the EU role in the global health and solidarity in health, reducing health inequalities in the EU, indicated the large differences among the Member States in the level of health and reinforce the EU's commitment to reduce health inequalities by supporting actions among Member States and stakeholders. Gap analysis. The gap in male life expectancy at birth, that is the difference between the highest and the lowest value among the EU 27 Member States, was 11.8 years for men and 7.9 years for females in 2011. The gap in healthy life years, that is disability-free life expectancy, was 90 years for males and 80.4 years for females. The gap in infant mortality was 7.3 infant deaths per 1,000 live births. During the last decade, poverty did not increase much, but the income inequality gap widened in almost all EU member states. The health gap is greater among women and younger EU populations. Clinical research has indicated a clear gap between socio-economic classes in chronic diseases like diabetes, hypertension, lung, heart and liver disease, stomach cancer, schizophrenia and depression. There is a six-fold gap between the risk of death of the socially isolated versus well-integrated people in some EU countries like Sweden. Between 30% and 50% of the homeless suffer from serious mental health problems in the UK. Social determinants. In the literature of public health and health economics, a great number of studies have indicated the close relationship between socio-economic status and health outcomes. Social determinants of health, such as education, occupation, income, housing, living conditions, diet, unemployment, and unhealthy lifestyle contributes to adverse health conditions across the EU countries. A social gradient in health status exists. People with lower education, lower occupational class, or lower income tend to die at a younger age and to confront a higher prevalence of most types of health problems. During the economic crisis, the socio-economic determinants of health became more apparent, with greater adverse effects on the health of the European population. In the Rio WHO conference on the social determinants of health on October 21, 2011, attended more than 1,000 participants, 122 WHO member states, international and national NGOs and social movement organizations. It was acknowledged the urgent need to examine the structural determinants of health, most of which lie outside the conventional health system per se. Sir Marmot's WHO report and the European Commission's report on solidarity in health have acknowledged that health inequities are politically, socially and economically unacceptable. They are also unfair, and the promotion of health equity is essential to sustainable development of our European health systems. According to the 2013 EU Annual Growth Survey, and in the context of the Europe 2020 strategy, the Commission's communication on investment in health highlights the need to improve cost effectiveness and sustainability of health systems by boosting economic growth and reducing health inequalities. Investing in health. Investing in health contributes to the Europe 2020 objective of smart, sustainable and inclusive growth. This implies that we should develop social and health policies aiming at a better and more accessible distribution of health resources, ensuring also the optimization of effectiveness and efficiency. It also emphasizes the need for more comprehensive and targeted social and health policies. Health is wealth, and investment in health contributes to economic growth, economic prosperity and welfare. People's health is an important social and economic component because it influences labour supply, increases productivity and improves the human capital of our societies. Investing in health, particularly during the times of the current economic crisis, is one of the great challenges in Europe. The ageing population, the increase in chronic diseases, the high cost of technology, and the ensuing problems of poverty, social exclusion and health inequalities require new strategies to tackle these problems. We should reform our health systems to ensure better access to our citizens, cost effectiveness and long-term sustainability in our healthcare systems. We should act together for health, adopting new strategic approaches. Investing in tackling health inequalities contributes to a more just, human and more equitable society with greater social cohesion and greater productivity. Adequate support from the European funds would help to fulfil these objectives. In the most inspiring introductory speech with this morning, Sir Michael Marmot classified Greece as a country with a relatively underdevelopment response to health inequalities. This statement requires a documented answer. I am delighted to inform you that despite the fact that Greece has the highest inequalities among the EU countries, I have inherited a great burden of health inequalities, but I have developed a number of actions and collaborations with international organisations to tackle health and social inequalities in my country with targeted and well-evaluated health policies. Last September, we signed an agreement with WHO on 9 areas of intervention such as primary health, e-health, public health and health inequalities. We have also a fruitful collaboration with the task force of the European Commission for reforming our health system. Tomorrow we will have a new law in the Parliament about the primary healthcare system and how we will give access to everybody, not only to the people that have insurance capability, in order to help them and put them out of the system that left them without any healthcare system. We confront health inequalities adopting a bottom-up approach by focusing at the vulnerable groups. We have developed a minimum package of health services for the vulnerable people who are the most deprived. We introduce tomorrow new legislation, as I said before. Within the Greek Presidency, we have a number of meetings for nutrition and physical activity, achieving impact on health inequalities. Horizon 2020 research programme with focus on social and health inequalities. There are some indicative initiatives. Let me conclude with some forward actions and messages. Let us shift our focus of analysis from healthcare and health services to tackling health inequalities. Let us increase our investment in health promotion, health protection and population health. Adopt better governance for our health system, strengthen European collaboration towards reducing health inequalities, monitor public health progress and increase accountability. I invite my European colleagues at different ministries of the European governments to take actions on social determinants of health in order to establish a more equitable, more economically productive and a more inclusive society. And for the end, I want to make this statement. The European Union has many problems, but we must never forget that the European Union still is the best place in our world to live, the place with a better democracy, the place that we respect the human rights more than anybody else. And we must not let this time of crisis, some people that always have to say some negative about the European Union to win this battle. We have to defend Europe. We have to defend the European Union, all the achievements that they have been done until now, and all the achievements we will do in the future. Thank you very much.